So what's up guys, I'm Dr. Science. Okay bro, let me ask you some question. What if I told you there's a cancer which is completely almost preventable but people lost their life just because they don't check for it? I got you bro, yes, it's about cervical cancer. So let's talk about cervical cancers today. Don't miss it. Let's see. Let me explain about some simple anatomy about the cervix, bro. So cervix is kind of something like this. There's something mysterious and some beautiful, interesting organ. It's a uterus. In uterus, the lower part of the uterus is simply we can use cervix. It's act like a door between upper vagina and the uterus. So that's the cervix. It's as you can see the picture below. So you can see cervix, how it looks like. So bro, in our story there's a villain. So our villain is simple tiny guy, what's it called, HPV virus. So human papilloma virus, there are so many strains of that virus. Usually the 16 and the 18 causes the cervical cancer. So how this small tiny guy, how this small villain causes the cancer, how it attacks our immune system and our body, it actually happens like this. Because of this HPV virus, they try to activate some proteins like E6 and E7 in our body. Because of this E6 and E7 proteins, they make our cell cycles irregular. Because of those irregular cell cycle, it causes the hyperstimulation of the growth of the cells. Initially it occurs as a precancerous lesion and then with the time it becomes malignant sometimes. So we'll see what are the signs and symptoms of this cancer. I have already mentioned about that it's a kind of a cancer. It means usually it's a kind of a collection of cells and it has a huge blood supply. So many blood vessels usually around the collection of the cell. Because of that, it usually appears as a friable exophytic mass. Since it is more friable, it is more prone to get damage, and because of the damage to the blood vessels, then they can present with the bleeding. So that bleeding can be presented as a postmenopausal bleeding, and it can appear as after intercourse. We can call it as a postcoital bleeding. So the first and the most important one is the irregular bleeding. The second one is the dyspareunia. Because of the chronic inflammation, tissues get inflamed, and when you do the intercourse, you can get pain. That painful intercourse is known as dyspareunia. The number 3 beautiful one, yes, actually since it is a kind of chronic inflammation, and it is also more prone to get a secondary infection. After a secondary infection, they can develop pus inside the cervix. The patient can be presented with the foul smelly vaginal discharge sometimes. Also there are because of the inflammation and because of the cancer cells can be invade into the sacral plexus, they can present with the pelvic pain. If the cancer is spread into the bladder, you can present with hematuria like symptoms. Hematuria means blood passes in the urine. If it is invade the rectum, what happens is actually you can present with the rectal symptoms like tenesmus, constipation like symptoms. Also in severe cases, the cancer cells can spread through the blood and the lymphatics and can cause loss of weight and loss of appetite like symptoms. So what should we do now? In our story, I have already mentioned about the tiny small guy who was the villain in our story. It was the HPV 16 and 18 viruses. So who is our hero? Is there a hero? Yeah, of course bro, we have a hero. Our hero is HPV DNA vaccine. So get vaccinated, because by the vaccinating you can almost completely prevent from the disease. So it's very important to get vaccinated at the time of the right age. So if you are eligible one, please get vaccinated. If you are eligible for the screening, please get screened for the disease. And because we can do something like a pap smear test and get some cervical smear test for the purpose of screening, as well as the final thing is share this video, because you can save a life. So many people die in each year, not because of it is preventable, but because of the lack of the awareness. So you have to aware the people about disease and be safe. Since this is my first attempt of doing a YouTube video in English language, so I'm not brilliant at English, so I try to improve my English as well. So that's how it goes bro. We'll see in next video. Good luck.